Hi, I'm Dr. Michael Dempewolf. I am a private practice orthopedic surgeon practicing out of Kansas City, Kansas. I have a sports medicine subspecialty fellowship training with a primary focus in shoulder and upper extremity conditions. With my sports medicine background, I see a various amount of injuries involving the shoulder and upper extremity. Those include things like rotator cuff tears, labral lesions, even shoulder arthritis. So a lot of the surgery I perform consists of arthroscopic rotator cuff repair surgery, labral surgery, and even up to shoulder replacements. Prior to my introduction to H-Wave, I was treating my post-surgical patients like a lot of orthopedic surgeons do. And the fact that they were getting preoperative nerve blocks, I was prescribing them opioid pain medicine for after surgery. What I was seeing is very typical post-operative bruising, post-operative swelling. I was getting fairly often requests for refills of their pain medicine, really just patients still using their opioid pain medicine at their first post-op appointment. What I see a lot used post-surgically that I don't personally believe in is ice therapy. I think it's very common for patients to get prescribed ice therapy. My belief is just that ice causes the opposite effects. Physiologically, ice causes vasoconstriction, and although it may numb the tissues for the patient, it's actually, I think, detrimental in their early recovery phase. I think the way we prescribe opioids in this country is a big problem. I think the physician community and those that prescribe medications, we tend to really overprescribe those medicines, and I think it's for a lot of small reasons, but it creates a big problem. One of those is patient satisfaction. I think physicians are really worried about what their patients feel, and unfortunately, satisfaction scores are sometimes tied to reimbursement. Another big reason is I think there's a lot of headache that comes to the office. Sometimes the office staff and the number of phone calls that we get for medicine refills or medicine questions. So in general, I think that leads to a lot of overprescribing, which then results in an excess of narcotics and opioid medicine just kind of floating around in the community to be used incorrectly. So I was actually introduced to H-Wave through one of my partners. He's a PM&R physician and deals a lot in chronic pain patients. And I saw him prescribing that a lot for some of his patients. And so I asked him about it, and asked about the device, and he was explaining it to me. And I think like a lot of people initially, I thought it sounded very similar to a TENS unit. But then I learned pretty quickly that that wasn't the case, and this is quite a bit different. And so, he was using that for chronic pain, and I thought, can I transition that into my practice and use that for some acute pain, really acute post-surgical pain? And so that was really my foray into the use of H-Wave, and I started to use it for post-surgical patients. And I saw quite a few surprising things. One of those was really a decrease in their use of post-operative opioids, which was really the primary goal. Secondarily, what I saw, which was very pleasing for me and for the patients, was a dramatic decrease in their swelling post-surgically, really minimal bruising, and their incisions are just healing much quicker. And so I think the patients really liked that as well. Actually, one of the few first H-Wave patients I did post-surgically, they come back to the clinic, and one of the nurses had to come out of the room to verify the date of surgery because their arm and the shoulder looked so good after surgery that they were very much surprised that they were there 6 days after a major shoulder surgery. So that's been really great in my practice. So early on, we were seeing some great results. Like we talked about the decrease in pain medicine use, the decreased swelling, just the overall better appearance of their incisions. These are anecdotal things, and as physicians, we're all scientists, and we really need to put objective data so we can help spread the good news. And so what we did is we created pain journals for the patients to fill out, and this consisted of just the one sheet that made it simple for them so that they could document anytime they used the H-Wave and anytime they took any medicine, both opioid narcotic medicine and non-narcotic medicine. And we really just tracked that data to really see, are what we seen early on, does that translate into something meaningful that we can tell the rest of the orthopedic community or the post-surgical community? Yeah, so once we started collecting the information that we were gathering from these pain journals, we did see some very promising objective data. We saw a dramatic decrease in pain medicine usage, and really just patient satisfaction scores were way higher with the use of the H-Wave for their acute post-op pain. So now I'm really using the H-Wave on as many post-surgery patients as I can, and we're really using it, in my mind, at the most critical juncture, which is immediately after surgery. So we are using sterile H-Wave electrodes that are being placed at time of surgery. When the surgery is finished, before the dressings go on the patient, the leads go on in very strategic places, and we do some pre-surgical counseling with the patient, pre-surgical education. They get contact by their local H-Wave rep day of surgery, the afternoon after surgery, to make sure that the machine's hooked up well, it's working well, they don't have any questions. really my goal is to get that on them immediately so we get some of the immediate benefits that we know about now. And really just have them use it at home when it's comfortable for them, really as an adjunct so that we can just help them do better faster. So I think H-Wave is great. I've been using it for about 4 years now. I think it's really one of the only tools that I have access to that I'm seeing some really great measurable results that's really making an impactful difference with my patients and in society really. You know, we talk about the decrease in opioid usage, really solving this surgeon's dilemma. I think the H-Wave is one of the only things that I've found that really helps solve that problem that us surgeons have.